Hi, my name is Georgia Hartzog, and this is the Long COVID channel. I decided to start this channel because my husband Todd has had long COVID for the last 3 years and is still struggling. I also feel like there is a lot of misinformation and just general lack of knowledge out there about long COVID. I'm a nurse anesthetist, and I'm always shocked by the number of medical professionals that I run into that don't have any knowledge about what long COVID is. So I decided that I would like to share our journey and struggles, and also just help increase the knowledge and awareness that is out there about this disorder. So today I thought I would cover diagnostic testing. Now, diagnostic testing is what will determine if you have long COVID or not. And I will tell you that this is an area that's very frustrating for a lot of individuals with long COVID, and I'll tell you why. The first thing that is usually going to occur if you have started having these symptoms that we covered in the last video is you'll go into your primary care, and they're most likely going to order some general blood work, okay? And that's going to be like a CBC or a complete blood count, your chemistry, which is like your electrolytes, maybe test for your thyroid, some vitamin levels like your vitamin B, your vitamin D. They might do a chest x-ray. They might do an EKG just to see how your heart is looking. And I will tell you that most of these tests are going to come back normal. And that's what's really, really frustrating, because you feel absolutely terrible on the inside. And then you go into the doctor and then you come back and they're like, oh, well, all of your labs look normal. And then you feel like they're telling you that you're just making it up, or it's all in your head. It's definitely not all in your head. I believe you, and I know what you're going through is terrible, even if this lab work is not showing that. And there are millions of others out there that also know that this is not just in your head. Now, I think that the reason that a lot of these tests are coming back as normal and not showing what is really happening is because these tests are just showing what's happening like in your bloodstream, right? These are like big things. Whereas what's happening with long COVID is on a much smaller level. We're talking, these are things that are problems with your mitochondria, or which are like your energy powerhouses. They're things that are happening on the cell surface, and things with like chemical mediators. I know a lot of you probably don't know what some of those things mean. We are going to deep dive into those in future videos and try to simplify those things down so you can understand what is actually happening in your body. But basically, for this video and diagnostic testing, it's kind of like something's wrong with your computer and somebody goes in and says, well, your screen works and your keyboard works, so everything is fine. But really there's like a software problem and it just keeps glitching. So these tests aren't going to capture what's really happening on these smaller levels, and it's not going to show what's happening down at these small unmyelinated nerve fibers, or with your autonomic nervous system. So just know, just because those tests aren't showing anything wrong doesn't mean there isn't something wrong, okay? And I also want to tell you that it's still important to go in and get these tests done. The reason being is it helps your physician and you just eliminate other possibilities of what could be going on, okay? And so I think that's also a very important component of this. Now, other diagnostic testing that they might want to do are ones that are system specific. That would be things like going in and having your lungs checked out and having something that's called like a pulmonary function test. This is where you breathe in really deep or you exhale all of the volume out, and that shows them how well your lungs are functioning, what kind of volumes you are having in your lungs, things like that. There's also some cardiovascular testing that they might do. There is what's called a table tilt test, and that's specific for POTS, where they actually put you on a table and they tilt you and they're going to monitor your heart rate and what it's doing as you shift positions. I said in my previous video that is one of the big symptoms is POTS, postural orthostatic tachycardia syndrome, where the heart rate jumps dramatically when you're going from laying down to standing up. So they do have a test for that. They may even want to do a stress test. They might want to do a cardiopulmonary exercise test just to show how well you can handle exercise. There might even be some cognitive testing, which is like testing your memory and how well your brain is functioning, how significant your brain fog is. And then they might also want to do an MRI, which would possibly show some inflammation in your brain. So those tests may show some level of damage and they may not, okay? I know my husband he did go see a cardiologist because he was having a lot of irregular heartbeats and fast heart rate. And they did put him on a Holter monitor, which is where they just put a big old patch on you and it monitors your heart rate and rhythm for several days. And that did show something. It showed what his heart was doing and he was put on medication. So those tests may show something, but they also might not. So don't get discouraged if they don't. Now, one test that is out there that was very beneficial for my husband was a skin biopsy test. Now, he has a lot of peripheral neuropathy, which is the burning, tingling, numbness sensation, like in his hands and his feet, actually in his legs, all of his legs. So he did have what's called a skin biopsy test, where they go in, they give you a little bit of local and kind of punch a little bit of your skin out. I know it sounds terrible, but it's really not that bad. And then they go in and look at the number of small nerve fibers on the surface, like the epidermis layer. And then they also look at the number of sweat glands that are innervated by these small nerve fibers, and they count those, and that number gives them a degree of damage that has been done. This is a very helpful test for anybody that is experiencing peripheral neuropathy. So if you are experiencing that numbness or tingling or burning or pain or any of those things, it is worth it to go and talk to your physician about this. This is something that needs to be done by a specialist. He goes and sees a long COVID physician, Dr. Broad, here in Austin at the UT Long COVID Clinic. He was the one that was able to perform that test for him. But I do believe neurologists can do that test as well. And for my husband, that test came back and it showed that he did have pretty significant damage there. So that was something that was very validating for him to see that, oh, look, there is a test that shows there is something going on here. I think that his number of innervations to sweat glands was actually 0. So they said that was really, really terrible. So definitely worth it to ask your physician about if that's something that you're experiencing. Another test or blood work that was really beneficial for Todd was he went to an immunologist, and he was referred there by his long COVID physician. Went to the immunologist, and he did a very extensive lab testing for him. Did a lot of his different antibody levels, and some of those levels came back very, very low. Abnormally low. It showed that he was immune compromised, and it was also one of the ways that he qualified to get IVIG therapy, which we will talk about in future videos because that's one of the few things that has been shown to be very beneficial for patients with long COVID. It's extremely expensive and it's very hard to have insurance cover it. So we'll talk all about that. But that was another lab test that showed, yes, there is something going on. And again, very, very validating for him to see that. There is one other test that I'd like to mention that hasn't come out yet, but it's worth talking about. There was an article just last month about this new blood test that they are starting to kind of test and look at for chronic fatigue syndrome, which is very similar to long COVID. I mean, they share a lot of the same properties. And so what this blood test does is it's looking at the DNA and the way it folds on itself. So think of like an origami. People with chronic fatigue and long COVID, their DNA is going to fold in a very specific pattern. So this test looks for that specific pattern. Of the testing that they've done so far, which has been fairly small, I think it's 40 something patients that they did it on, it did have a 92% chance of detecting correctly those individuals, which is fantastic. But unfortunately, that blood test is not available yet. And I should say that it is funded by a biotech company. So, take that for what it's worth. Still a small sample size and not available to the public yet. So that's really all I've got right now as far as diagnostic testing. I would love to hear from everybody out there that has long COVID or knows somebody with long COVID. What diagnostic tests have been helpful for you, and anything else. And if there's anything else you'd like to see me cover, I would love to hear from you about that. All right, well, I will see you guys on the next one.